So we're coming up on day 2. Yesterday we had immersion day for a couple PTs that came in and watched me go through a day's worth of patients. So live patients, treating them, follow-up visits, evals, watching the whole process put together so everything makes sense. Last night we had all 8 of our students here reviewing functional screen, how to do it, why we do it, why we don't waste our time on special tests and differential diagnoses, and then getting into neurophysiology, the how, what, and why of neuromuscular facilitation tests and why we do not do manual muscle tests, and what we do when we do our palpations to reinstate normal neuromuscular facilitation to those inhibited muscles, which is the root cause of all orthopedic pain and injury. So today we're going to go through, before lunch, we're going to get through testing and facilitating all 5 quads, all the hamstrings, all the glutes, all the deep internal hip and external hip rotators. So watch and see how we do it.